Hello, and once again, a very warm welcome to Roundtable from me, David Foster. Now, is coronavirus a great equaliser, or will it actually exaggerate inequalities, create more class, social, and financial divisions? Who says? We're all in this together. So, greater inequality, or perhaps, once the disease has done its worst, the great healer. Is it too much to hope that the lessons learned will bring about a kinder and a fairer world order?
As COVID-19 spreads across the globe, the economy is on life support, and along with the already devastating human toll, people on low incomes are suffering the consequences. Charity group Oxfam has warned that recession could push an extra 500 million people into poverty, 8% of the world's population, unless urgent action is taken. People in low-income jobs are on the front line of the outbreak. Nurses, delivery drivers, supermarket workers are at risk because they are exposed, while others in the gig economy or on zero-hour contracts have found their income disappear. UK campaign group the Joseph Rowntree Foundation said millions of workers trapped in poverty are more likely to have insecure jobs with fewer rights and employee benefits, and they are less likely to have savings to help cover additional unplanned costs or gaps in income. According to researchers, low income is associated with higher rates of chronic health conditions such as diabetes and heart disease, factors that increase vulnerability to COVID-19. So the pandemic brings up an important question. Are we all together in this, as some suggest, or is the coronavirus deepening existing inequality, and how can that be prevented?
Okay, time to let the conversation begin in a little while. We will say hello to Annelies Goger, economic geographer at the Brookings Institution, looking at new ways to address rising inequality and improve access to economic opportunity. Also, Xuejie Ding from Oxford University, who's researching how the way we live affects our lives. But right now, we welcome Ben Eder, a doctor currently working in A&E, that's Accident and Emergency, and also a member of two groups which he will tell us about, aiming to bring fairer healthcare to everyone around the world. And Elena Magrini is with us, senior analyst at the Centre for Cities, looking at the future of work within the United Kingdom. Elena, come to you in just a moment. But Ben, first of all, you work in A&E. You are dealing with people presumably pretty ill being brought in with coronavirus, but that's not where it ends for people who do the work you do.
Yeah, it absolutely doesn't end there. And one thing we want to make clear today is that accident and emergency continues for everyone, and there's been an incredible readjustment and redesign of the health workforce and infrastructure to ensure that no matter what your concerns are, we are here to help you and support you. And that's one of the concerns that we have, is that there's been a drop in people presenting to healthcare, and we want to make sure that you know that we are here to care for you at this time. And I suppose that goes back to the narrative that's been shared of stay at home, protect lives, save the NHS. And I think it needs to be re-emphasised that it should be stay at home, but if you are unwell, then we are here to care for you.
Apart from working in A&E, and I know you're having a little bit of a rest at the moment, there are two groups aiming to sort of level the playing field a little bit. And we are talking about equality on this programme. And those two groups are Medact and People's Health Movement UK. How does the work you do with them come to the fore in a crisis such as this?
One of the challenges, I suppose, in A&E and in healthcare settings is that the root causes of the problems that people come into goes much deeper and bigger to what I see in the emergency department. It's about people's education. It's about people having secure housing and secure employment. And the organisations that I'm a part of, Medact, works with health professionals to campaign around the right to health for all and looks at those broader determinants that enable people to be healthy.
Mm.
And then, as part of the People's Health Movement, that's part of a global social movement that fundamentally believes in the right to health and kind of advocates for that in its
Sure.
measures.
Can we talk about the UK side of things first of all? Do we not already have equality in healthcare, universal healthcare in the United Kingdom? Is that not the cornerstone of the National Health Service?
Well, I would like to say that it is, but at its founding, and that's what kind of drove me to become a doctor, is that idea of universal healthcare and is of the idea that there is a right to health for all. But at the moment, the NHS isn't freely accessible to everyone, and that's some of the great work that Medact, alongside other organisations such as Docs Not Cops and JCWI, have been championing is of ending the hostile environment in the NHS that is deterring people from seeking care who desperately need it. On the 8th of April this month, a man from the Philippines who had undocumented immigration status died of coronavirus and didn't seek care. And it's not enough that the government has said that coronavirus is exempt from charging regulations. We need a complete end to the hostile environment, to go back, as you rightly said, to the founding principles of the
Yeah.
NHS, that healthcare is free
Back
at
with,
the point of use.
back with you in just a moment, Ben. Let me go to Elena, and I know you think the response, whatever happens with this pandemic, it's crucial to reducing inequalities in longer term, not just in healthcare, but overall.
Yeah, absolutely. Because what we see now is that in times during a pandemic, the underlying inequalities that we see in a society are exacerbated. So if we want in the future to avoid being in the situation in which we are now, in which some parts of the society, some group of people are much more effective in terms of the economic impact of the pandemic and of the lockdown that it has created, then we need to address all the underlying issues that have created inequality in the first place. So that means making sure that people have access to the education opportunities they need to thrive in the labor market. It is about ensuring that every place is attractive to business, and so that every part of the country can thrive and be in a better position to thrive in the future.
Is improvement at all possible? Because we're going to have presumably less money as a global community after this. There are going to be fewer jobs, therefore less money will be produced. Is any kind of improvement possible?
It is hard. It won't be easy to begin with because, as you said, we will risk to see job losses in the immediate short term after this lockdown, and despite the measures that the government is trying to put in place. But the thing is, trying to address inequalities, spatial inequalities and inequalities between different groups of peoples, take years. And so if we want to start and see an outcome in the future, we need to start now. And usually, when a crisis happens, and a pandemic is a good example of that, there is a window in which people have more appetite for change than they normally do. And so it's a great opportunity to try and introduce measures that we haven't yet introduced.
Yeah, exactly. I'm going to put that to Ben, and you can come back on it in a moment, Elena. By all means, how do you translate the changes that we're seeing at the moment, the positive changes that we're seeing at the moment, into something that benefits poorer people, less advantageous people with less advantages over the long term, rather than a short-term approach just to get back on our feet and carry on as normal?
What we are seeing today is has not happened by coincidence. It's a result of inequality happens due to political choices, and we have seen over the last 10 years in particular, through austerity measures, kind of our social fabric destroyed and public healthcare in this country destroyed. And as Elena says, this is a moment for change, and we need to address those root causes.
But Ben, how do you bring about change?
I would say that those people that have been that do face the worst inequalities, those people need to really be at the centre of that change and driving that change forward, as otherwise we risk going back to how the world was before, which has produced this crisis. And so those people need to redesign and take forward that vision of a society where there is people have housing and people have access to food, and health is not based on profit but is based on need and is about a right to health for all. And I'm not saying that's easy, but it's what we must do.
Elena, is there not a paradox here that the biggest societal changes have often happened after the worst catastrophes, after world wars, Great Depressions, etc., and that this could perhaps present some kind of opportunity?
Yeah, I mean, as I said, it is usually after big traumatic events that people are actually have more appetite for change, as we've seen in the past. In fairness, when it comes to talking about regional inequalities, inequality between different places in the UK, we know that the government, especially this new government, has made reducing inequalities between different parts of the country a flagship policy. And that was before the coronavirus pandemic kicked in. So if this commitment stays and is reinforced after we get out of this immediate short-term big crisis, then we have hope that maybe for the future we will see a reduction in inequalities between different.
So it is very much time for fingers crossed. Ben, I know you want to remember key workers, healthcare workers. We want to remember them too. But just tell me about when you go back to work. Do you expect the pressures on the National Health Service to have eased a little bit? And when you were in A&E last time you were at work, did you feel it was very close to breaking point or what?
Where I was working anyway, it doesn't feel close to breaking point, and that is because of the huge effort that has been put in by all staff, from the porters, the healthcare assistants, the nursing staff, the doctors, of kind of changing how they work. But we are set up to deal with anything that happens, and we're here to care for people. And so, yeah, when I go back into work this weekend, I will be there. We will be there to care and look after people.
Absolutely. Listen, thank you very much indeed. That's Ben Eder, working in A&E as a doctor, but also doing so many other things. And Elena Magrini, looking at the future of work in the UK. We appreciate your time on Roundtable very much indeed. Thank you. And at this stage in the programme, we welcome Annelies Goger, economic geographer at the Brookings Institution, looking at new ways to address rising inequality and improve access to economic opportunity, and also Xuejie Ding from Oxford University, researching how the way we live affects our health. Great to have you both with us. Annelies, let me come to you first of all. I know you're hoping for a silver lining out of all of this. What would it be and how would we get there?
One of the things that I'm hoping for is that, for example, having so many people apply in the US for unemployment insurance and having that experience of just how broken these systems are and how long we've disinvested in them will give them an opportunity to realize that we really need to update them and fix them and make them stronger. I feel like for 30, 40 years, we have not really properly invested in a robust safety net in the US. And in fact, that was a deliberate decision, starting with Reagan and Thatcher all the way through. But I think an event like this can make more people realize that, when an unexpected event happens, and that could be individual like cancer, or it could be global like a pandemic, we need to have something there to protect people so they can, not be completely knocked off.
Annelies, I know an economic geographer takes a look at where people live, how they live, affects their economic opportunities, their social standing, etc., etc. Do you think that the gap between the haves and the have-nots was getting smaller or wider, and what will this do to it in all likelihood?
There's a great deal of evidence that the gap has been getting wider, and the context that I know the best is in the United States. And I think really thinking about how will the pandemic affect inequality, I think about three factors. So one is the pre-existing level of inequality, and in the U.S. we've had centuries of structural racism. We've had gender disparities and ageism and all other forms of inequality. And that is going to, as you can already see, it's already playing out in terms of who's getting sick, who's getting hospitalized, and who's dying, but also in terms of who has the most protections in the labor market when a shock hits. So in the US, I think that's one thing that we're not well prepared for. The second thing is...
Sorry, if I could let you,
yeah.
if you don't mind holding that thought for just a moment, I want to bring
Sure.
Xuejie in. You take a look at the way we live and how it affects where we end up in life. Is it likely that it affects our susceptibility, our exposure to this pandemic where we find ourselves?
Yes, I think definitely. So we know that high death rates have been observed for older population and those with pre-existing conditions such as cardiovascular diseases, diabetes, and respiratory diseases. And there are overwhelming evidence that low-income individuals are generally at higher risk of developing those pre-existing conditions at an earlier age due to reasons such as economic deprivation and environment of living. For example, people can be more vulnerable to coronavirus if they are in an area with bad air pollution, which is tightly associated with neighborhoods that are located near highways, industrial areas, and etc., as the land is cheaper. And also for exposure, people who struggle financially are more likely to live in densely populated households, and that increases risk of exposure and transmission. And in
Absolutely,
a lot of
not only that, but they don't have access to outside space. They presumably have less money to go around among more people. All of which socio-economic factors make them less likely to be looking after themselves in the way that you perhaps should.
Yeah, exactly. So the social disadvantaged may not have the option to afford working from home, right? Less paid jobs usually cannot be done remotely. As people keep working, the risk of getting infected and bring the virus home to their, they risk higher risk of bringing the virus home to their families.
Okay, Annelies, certain workers, certain racial groups more affected than others in the United States, I'm sure, as in the rest of the world. But why is that? Is it just pretty obvious?
Well, I wouldn't say it's obvious, but I would say essentially, in the US at least, over the last 30 or 40 years, protections for workers that are working part-time or who are new entrants to the labor market, such as students or people coming back after having a baby, folks who are less attached to the labor market, in our safety nets, they have less entitlement to things like unemployment insurance. And so in the US context, when this happened, because so many of the people that I'm talking about were exactly the people who were most affected by this virus, people in service sector jobs, that is why the Congress had to basically create 3 whole new programs and try to implement them in the middle of a crisis, which has delayed the disbursement of those benefits. So I think the sort of long run consequences of not fully protecting everyone has led to a lot of those workers suffering immensely in this first month in the United States.
Some good things have come out of terrible things. That's the paradox, and we referred to that earlier on, such as public housing in the UK. That was after the First World War, social security and the health service in the UK after the Second World War, big economic progress in the United States with the New Deal, Roosevelt's New Deal after the stock market crash. So things can happen. I want you to reflect on this quote. Listen to what I found this morning. There's a guy called Walter Scheidel, wrote a book called The Great Leveler, violence and the history of inequality from the Stone Age to the 21st century. This is one of the things he said. Violent shocks were of paramount importance in disrupting the established order, in compressing the distribution of income and wealth, in narrowing the gap between rich and poor, which is to say that one hopes that good things can come out of this. But my question to you, really, both of you, is why did it ever need to get to that point? Xuejie, you first.
I don't think I agree with this statement that much. From right now, what we actually see is the coronavirus actually amplifies existing inequality, and pre-existing social vulnerability can get a lot worse in a situation like this. For example, it's not just income inequality that we need to pay attention. There is also gender inequality, for example. A report by my colleagues here at Oxford pointed out that, for example, the closure of nurseries and schools, and also together with the societal expectation of women as the primary caregiver, is likely to increase the domestic burden on women disproportionately. And so I think this is a great opportunity for us to look at why there are so many aspects of inequalities and what we need to do to prevent this from happening in the future.
Okay, Annelies, I don't know whether you agree or disagree. We just heard there from Xuejie doesn't think that is particularly relevant, but good things may well come out of this. Why did it ever get to this stage?
Well, I think a lot of it comes down to the fact that we've lived in a period of economic liberalism where the main ideological belief was, oh, we should not intervene, the economy will distribute wealth equally, and eventually will lift all boats, and we don't need to have government providing a lot of buffer and other services to help generate that. And I think after 30, 40 years of that, we're coming to a point where it's becoming starkly obvious that in a situation like this, you need fast and decisive and well-coordinated leadership. And
which may,
think,
I'm sorry, I didn't mean to override
yeah.
you, which may well mean a return from local control perhaps to more federal control.
Right. So I think I'm not sure. I think it could go either way, right? So I could see it going back to a sort of pushing back against devolution and more centralization of governance, because people realize that we need to shore up certain public goods and make sure that people have substantial number of people have access to well-being and health and so on. Or we could see the other extreme, which is what happened, I think, in the U.S. after 2016, where you have a rise in populism and you have a lot more division and strife, and I think that could be very destabilizing for democracies, and history has examples of that as well.
Let us hope not. Xuejie, Annelies, we're coming towards the end of the program, but Xuejie, let me throw this one at you. You think there may well be an increase in the gap between the haves and the have-nots. How do you stop that from happening? What message would you have to those who have the ability, perhaps, to prevent it from happening?
I think it is important to bear in mind that inequality is harmful for everyone, rich or poor. And at this stage, I think policy measures should seek to counter family economic crisis, particularly for vulnerable and precarious workers who are less able to comply with policies that allow social distancing, and make sure the social disadvantaged group has the necessities to live a life. And also we need to support, value, and protect the frontline workers.
Is that likely?
Depends on government's capacity to proceed. I think UK currently is doing a relatively great job in developing that, but I also know that in the United States, people, a lot of disadvantaged groups are living a very hard life to do that. And I think for key workers, maybe we should introduce, for example, out of our childcare to take off some burdens from them, and also provide childcare for a single parent family if they need it. And in the long run, what we need perhaps is invest more in the education, especially in early stage, early education to reduce gaps in inequality and also increase economic mobility.
Listen, thank you very much indeed. Everybody in this crisis has a wish list. Tough times, you say, for some, but tougher times for many people about whom we have been talking today. The inequality gap, is it going to get bigger, or is it going to be an opportunity perhaps to address some of the problems of the past? We will have to wait and see, but right now it's time to say thank you very much indeed to Annelies Goger and to Xuejie Ding. We appreciate you taking time to be on this program with us today, and we appreciate the fact that you at home, wherever you happen to be around this very strange world at the moment, have taken the opportunity to watch this edition of Roundtable. From me, David Foster, from everybody else on the team, we hope to have your company next time. Stay safe. See you then, I hope.